pn15. A client with an above the knee amputation is being taught methods to prevent hip flexion deformities. Which instruction should be given to the client? A. Lie supine with the head elevated on 2 pillows. B. Lie prone every 4 hours during the day for 30 minutes. C. Lie on your side with your head elevated. D. Lie flat during the day. Rationale to prevent hip flexion deformities. The client should be instructed to lie prone every 4 hours for 30 minutes during the day. This will force the leg to extend to 0 and prevent the contracture. Answer A, C, and D are incorrect because lying on his back or side, or flat will not help. A client has returned to his room following an esophagoscopy. Before offering fluids, the nurse should give priority to assessing the client's A. Level of consciousness. B. Gag reflex. C. Urinary output. D. Movement of extremities. Rationale: the client's gag reflex is depressed before having an EGD. The nurse should give priority to checking for the return of the gag reflex before offering the client oral fluids. Answer A is incorrect because conscious sedation is used. Answers C and D are not affected by the procedure, therefore, they are incorrect. The LPN-LVN is describing a 24-hour urine collection to a client. Which of the following explanations is most accurate? Avoid and save the urine at the start of the collection period to begin the process. B. Wash the perineal area with soap and water before each void. C. Collect the urine in a sterilized container or receptacle. D. Empty the bladder at the end of the collection period and save this urine. Rationale: proper procedure is to empty the bladder and save the urine at the end of the collection period. Clients should void and discard the urine at the beginning of the collection period, so answer A is incorrect. Answer B is utilized when collecting a midstream, clean catch specimen, so it is incorrect. The urine doesn't have to be collected in a sterile container, therefore C is incorrect. A client is hospitalized with a diagnosis of antisocial personality disorder. According to Freud's psychoanalytic theory, antisocial personality disorder arises from faulty development of the IDB ego, C superego, D preconscious. Rationale: according to Freud's psychoanalytic theory, antisocial personality disorder arises from faulty development of the ID. Answers B, C, and D are incorrect because they are not related to the development of antisocial personality disorder. The nurse is evaluating nutritional outcomes for an elderly client with anorexia. Which data best indicates that the plan of care is effective? A. The client selects a balanced diet from the menu. B. The client's hematocrit improves. C. The client's tissue turgor improves. D. The client gains weight. Rationale: the client with anorexia shows the most improvement by weight gain. Selecting a balanced diet, as in answer A, is of little use if the client does not eat the diet. The hematocrit in answer B is incorrect because although it might improve by several means, such as blood transfusion, it does not indicate improvement in the anorexic condition. The tissue turgor indicates fluid stasis, not improvement of anorexia, therefore, answer C is incorrect. Which of the following meal choices is suitable for a 6-month-old infant? A. Egg white, formula, and orange juice. B. Apple juice, carrots, whole milk. C. Rice cereal, apple juice, formula. D. Melba toast, egg yolk, whole milk. Rationale: rice cereal, apple juice, and formula are suitable foods for the 6-month-old infant. Whole milk, orange juice, and eggs are not suitable for the young infant, therefore, they are incorrect. You will be reinforcing teaching and instructing the patient. Which basic principle of teaching should you follow? A. Sequence the instruction from the least complex to the most complex. B. Assume that the patient knows little or nothing about the topic. Cyrillic letters tell the patient to call their significant other so you can instruct them. D. Use medically oriented terms so the patient will be able to speak with the doctor. Rationale: you should sequence the instruction from the least complex to the most complex when reinforcing teaching and instructing the patient. For example, if you are instructing the patient about coughing and deep breathing, you should begin the instruction by demonstrating normal breathing, then deep breathing, and finally combining deep breathing with coughing. You should not assume that the patient knows little or nothing about the topic. You should determine what they know. It is not necessary to have the patient call their significant other so you can instruct them. This is only necessary when the patient is not able to understand the instructions. Lastly, you should not use medically oriented terms and medical jargon, but instead, terms that the patient understands. Q. The nurse is performing an assessment of an elderly client with a total hip repair. Based on this assessment, the nurse decides to medicate the client with an analgesic. Which finding most likely prompted the nurse to decide to administer the analgesic? A. The client's blood pressure is 130/86. B. The client is unable to concentrate. C. The client's pupils are dilated. D. The client grimaces during care. Rationale: facial grimace is an indication of pain. The blood pressure in answer is within normal limits. The client's inability to concentrate, along with dilated pupils, as stated in answers B and C, may be related to the anesthesia that he received during surgery. Q. A client with AIDS asks the nurse why he can't have a pitcher of water at his bedside so he can drink whenever he likes. The nurse should tell the client that A. It would be best for him to drink tap water. B. He should drink less water and more juice. C. Leaving a glass of water makes it easier to calculate his intake. D. He shouldn't drink water that has been sitting longer than 15 minutes. Rationale: the client with AIDS should not drink water that has been sitting longer than 15 minutes because of bacterial contamination. Answer A is incorrect because tap water is not better for the client. Answer B is incorrect because juices should not replace water intake. Answer C is not an accurate statement. Therefore, it is incorrect. Q. The 5-year-old is being tested for pinworms. To collect a specimen for assessment of pinworms, the nurse should teach the mother to A. Examine the perianal area with a flashlight 2 to 3 hours after the child is asleep and to collect any eggs on a clear tape. B. Scrape the skin with a piece of cardboard and bring it to the clinic. C. Obtain a stool specimen in the afternoon. D. Bring a hair sample to the clinic for evaluation. Rationale: infection with pinworms begins when the eggs are ingested or inhaled. The eggs hatch in the upper intestine and mature in 2 to 8 weeks. The females then mate and migrate out the anus, where they lay up to 17,000 eggs. This causes intense itching. The mother should be told to use a flashlight to examine the rectal area about 2 to 3 hours after the child is asleep. Placing clear tape on a tongue blade will allow the eggs to adhere to the tape. The specimen should then be brought in to be evaluated. There is no need to scrape the skin, as stated in answer B. Collecting a stool specimen in the afternoon will probably not reveal the eggs because the worms often are not detected during the day. Therefore, answer C is incorrect. Answer D is incorrect because eggs are not located in the hair. Q. A client